Good day, everyone. Once again, I am Erin Bautista Vitus. So today we're gonna talk about depression or mental healing. In today's generation, most of the people are suffering from mental illnesses or what they call depression. In fact, 8 out of 10 individuals are battling from it. Fortunately, as we move forward, half of the population are also getting aware from this issue. And sadly, half does not. So this day, let's talk about the cause and effects of depression. And at the same time, I will also give some useful points on how to deal with such things. So let's begin. The objective of this topic is to help aid the students with depression by giving some advices how to prevent oneself from depression and provide guidance regarding on mental healing. Everyone occasionally feels blue or sad, but these feelings are usually short-lived and pass within a couple of days. When you have depression, it interferes with daily life and causes pain for both you and those who care about you. We all know that depression is a very common but serious illness. So, what is depression? So, the definition of depression is a common mental disorder that presents with depressed mood, loss of interest or pleasure, feelings of guilt or low self-worth, disturbed sleep or appetite, low energy, and poor concentration. So, ibig sabihin ito ay if you are suffering from from depression, makakaranas ka ng wala ka nang ganang kumain or wala ka nang ganang gawin yung bagay na dapat gawin, di ba? And then, yung di ka makakatulog ng mahimbing and yung wala ka nang you don't have a concentration, yung di ka na makaka-concentrate kung ano yung dapat mo gawin sa yung bahay or sa yung paligid, di ba? Depression also is the leading cause of disability as measured in the fourth leading contributor to the global burden of disease, or known as DALIS, in 2000. By the year 2020, depression is projected to reach the second of the ranking of DALIS calculated for all ages, both sexes. So today, depression is already the second cause of DALIS in the age category 15 to 44 years for both sexes combined. So, ibig sabihin nito, every year, mas lalong marami pa yung nakaka-experience ng depression. Year by year, day by day, mayroon talaga nakaka-experience ng depression. At nakakalungkot lang pakinggan na yung age category pa naman ay 15 to 44 years, both men and women na. Maybe these are those students yung bagong married lang, and then they don't know how to manage their time, they don't know how to manage their self. Maraming problemang dumarating sa buhay nila, and then they get depressed, diba? Nakakalungkot lang pakinggan, but this is the reality. The prevalence for this is, first, depression occurs in persons of all genders, ages, and backgrounds. Ang depression pala ay walang pili. Walang pili, mababae ka man, malalaki, matao ka man, or mahayop, makakaranas ka pa rin ng depression, di ba? And then, depression also is a common affecting about 121 million people worldwide. So as what I have said a while ago, yung pinaka-common talaga yung depression na sakit, di ba? And then, depression is among the leading cause of disability worldwide. Depression also can be reliable diagnosed and treated in primary care. And lastly, fewer than 25% of those affected have access to effective treatments. What are the different forms of depression? There are several forms of depressive disorders. First is major depressive disorder or major depression. When we say depressive disorder, it is persistent feeling of sadness and loss of interest. Ibig sabihin, ito ay yung palagi ka na lang malungkot, nawalan ka na ng interest sa mga gawain, and then this affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. The symptoms for this are feeling of sadness, tearfulness, emptiness, or hopelessness. Number 2 is dysthymic disorder or dysthymia. Ito ay yung mawalan ka na ng gana sa pang-araw-araw mong gawain at yung mawalan ka ng pag-asa, diba? Then, lack of productivity and have low self-esteem. So, this may significantly interfere with your relationships, not just in love, but with your friends, the relationship from your family, diba? Then, sa school, sa trabaho mo, and to your daily activities. And then number 3 is minor depression. And there are three types of minor depression: the psychotic depression, postpartum depression, and seasonal affective disorder or the SAD. Psychotic is, when we say psychotic, it involves a break or disconnection from reality. Yes. And then, the symptoms for this are hallucinations, yung mag-hallucinate ka, then you're seeing, hearing also, and then delusions. Delusions is, ito yung naniniwala ka sa mga bagay na di dapat paniwalaan, di ba? Yung naniniwala ka na maging kayo pero hindi pala siya is. So, hindi pala yung totoo, di ba? And then also, slowed thoughts, feelings, and movements. Those are the symptoms of psychotic. The next one is postpartum depression. Then the third one is the seasonal affective disorder. Seasonal. So, hindi talaga ito permanent. Diba? It is a type of depression that's related changes in seasons. SAD begins at the end about the same times every year. If you're like the most people with SAD, your symptoms starts in the fall and continue into the winter months, sapping your energy and making you feel moody. So the symptoms for this are yung mawalan ka ng gana sa pang-araw-araw mong gawain, and then yung gusto mong kumain ng mga carbohydrated na pagkain, and then yung mawalan ka ng gana mabuhay, yung gusto mo na lang mamatay, di ba? Tas feeling down most of the day. Ito talaga yung mararanasan mo if you have a seasonal affective disorders. And lastly, bipolar disorder. It is a mental illness that brings severe high and low moods and changes in sleep, energy, thinking, and behavior. So, kadalasan talaga rito, ang nakakaranas ay yung mga babae talaga. If they have their menstruation or periods. Kasi, for example, if they have their menstruation, at the very start at the very start masaya sila. Tapos after how many seconds, bigla na lang sila nagalit. We don't know how to deal with their emotions, 'di ba? That's why they called bipolar. Yung masaya ka na, tapos bigla ka na lang nagalit, 'di ba? Or yung nagalit ka, tapos bigla ka na lang tumawa at naging okay na kayo sa isa't isa, 'di ba? And those are the different forms of depression. At sana naintindihan niyo. So, okay, let's proceed to the next. Signs and symptoms of depression. First is persistent sad, anxious, or empty feelings. Second, feelings of hopelessness or pessimism. Third, feeling of guilt, worthlessness, or hopelessness. Fourth, irritability, restlessness. And then the fifth one is loss of interest in activities or hobbies on pleasurable, including sex. And then the sixth one is fatigue and decreased energy. Difficulty concentrating, remembering details, and making decisions. Insomnia, early morning wakefulness, or excessive sleeping. Overeating or appetite loss. Thoughts of suicide or suicide attempts, aches or pains, headaches, cramps, or digestive problems, and do not ease even with treatment. The causes of depression. First is genetic or hereditary. Second, biological or biochemical or medication. The third one is dietary. And the fourth one is environmental. And then the fifth one is the socio-cultural factors or situations or relationships or personality. So, okay, let's talk about how is depression treated. So, depression can be serious, but it is also treatable. Treatment for depression includes, first is self-help. You can do regular exercise, getting enough sleep, and spending time with people you care about, and can improve depression symptoms. Then the second one is counseling. Counseling or psychotherapy is talking with a mental professional. Your counselor helps you to address your problems and develop coping skills. Sometimes brief therapy is all you need. Other people continue therapy longer. Then the third one is alternative medicine. People with mild depression or ongoing symptoms can improve their well-being with complementary therapy. Therapy may include massage, acupuncture, hypnosis, or biofeedback. And then the next one is medication. Medication is a prescription medicine called antidepressant. Can help change brain chemistry that causes depression, and antidepressant can take a few weeks to have an effect. Dili na siya diretso nga mo epekto. Pag inaman na ni mga tambal, mo epekto din siya. But that's not. So, some antidepressant have side effects, which often improve with time. If they don't, talk to your provider. A different medication may work better for you. And then, the last one is brain stimulation therapy. Brain stimulation therapy can help people who have severe depression or depression with psychosis. It is a type of brain stimulation therapy, includes electroconvulsive therapy or the ECT, and then the transcranial magnetic stimulation, the TMS, and then the vagus nerve stimulation, the VNS. Someone asked me, can depression be prevented ba? So here's the explanation. You can help prevent depression by getting enough sleep, eating a healthy diet, and practicing regular self-care activities such as exercise, meditation, and yoga. If you have had depression before, you may be more likely to experience it again. If you have depression symptoms, get help. Care can help you feel better sooner. And that's all. Thank you for listening, and God bless you all. If you have question, kindly turn on your microphone or please comment below. Thank you.